Microsoft has been an inaugural member of the Hospital Tomorrow conference because we believe that U.S. News and World Report really had the ability to bring industry thought leaders together.
You'll have the opportunity to network and share best practices with your colleagues from around the country. In short, we've gathered the best people with the best solutions in one place at one time.
So a hospital in the next 10 years is going to look very different from what it looks like today. We recognize that digital is going to transform our lives in every way, and that's going to also change our interaction with our healthcare setting. There's really no reason why all interactions have to take place in brick and mortar. They can happen at all stages digitally.
It'll be about connectivity to both other providers and to patients.
The best hospitals are really going to embrace more open technologies and open architecture within the systems that they're using to really spur innovation.
There's going to be a lot more consolidations as we transition from hospital companies to healthcare companies, and we start taking care of populations. It's that whole transition from volume to value.
The hospital will be a far more productive place than it is today because it has to. And I think finally it's going to be a much more personal place. Care is going to be much more tailored to the person and organized around the interest of the patient as opposed to being organized around the institution.
So what we're seeing is teams of people taking care of patients and teams of people working with consumers to ensure wellness. So I think that fundamental concept of an individual patient with an individual physician has already changed to a great extent.
And I think that doctor of yesterday took care of the whole person. So I think places like the medical home or your PCP really need to think of you as the whole person.
Patients have options and choices, and that the patient isn't necessarily looking for the definitive answer. They're looking for a partner. I think healthcare is fundamentally a human endeavor, and patients really respect their doctors and nurses, but I think they want to know them as humans, not just as icons.
Where it changes most, I think, is in the amount of information that patients want to know about, the amount of information that they want to have some kind of ownership over. We're generating scads and scads of data. The data fundamentally belong to patients, and they want to be able to have access to those data and be engaged in decisions that are being made on the basis of those data.
Oh, technology is changing patient care in a big way. I mean, the truth of it is that the consumer, the patient, is really now in charge of their health. Because information has been digitalised, because they can find out so much more about the condition they have or the condition they fear they might have for themselves or loved ones, they can now access information right across the internet.
But I think technology, the way it's going to be best utilized, is it's coming down to how do you integrate it into the care experience, and how do you integrate it into the patient experience so that we know more about patient preferences, we know how they want to be communicated with, we know what they like and don't like, we know what types and times of appointments they're going to need in the future. If we use and leverage technology, it's going to help the patient experience overall.
I think it's also important that care is available wherever you are. And so care anytime, anywhere, and have that connectedness through any device is going to be very important going forward. So I think technology plays a huge role.
And so I think long-term, technology can help us provide better healthcare and reward excellence in healthcare. We're going through a transition period right now where it is expensive and time-consuming, and those benefits aren't as clear at this point.
And I think with our iPhone apps and our ability to, everybody's got their Fitbit and they're tracking so many wellness parameters, they're also going to be much more aware of key facts, key figures that impact on their own health, and they can truly become partners with us as we move forward. So that's going to be a huge advantage of the technological revolution in healthcare.
As leaders of your institutions, you have an enormous responsibility. The decisions you make now and going forward will affect millions of individual lives and will shape the future of American healthcare. That's why this forum is so important.
Next year we'll be back in Washington in what will be a very important year.
We hope you can join us to continue the conversation.